Welcome to the deep dive. You've brought us your source material. And like always, our goal is to really dive in, pull out the key knowledge, and give you that informed shortcut.
Hmm.
Today, we're doing a deep dive into Pectus Excavatum, specifically in dogs and cats, and we're sticking strictly to the information you've shared. We're going to unpack what it is, who gets it, the signs, maybe why it happens, diagnosis, treatments, all straight from these sources. So let's get started.
Absolutely. Okay, so based on this material, Pectus excavatum is fundamentally described as a deformity. It involves the sternum, that's the breastbone, and also the costal cartilages.
The connections to the ribs.
Exactly, the connections between ribs and sternum. And what happens is you get this narrowing of the chest cavity. It's reduced from top to bottom, dorsal to ventral, and it's especially noticeable towards the sort of bottom end of the sternum.
Okay, so a structural thing, a physical shape issue with the chest. But it's not just about looks, right? Your source material is pretty clear. It has functional impacts.
That's a really critical point from your sources, yeah.
Yeah.
This narrowing, it can cause secondary problems affecting both breathing and the heart, the cardiovascular system.
How so?
Well, the reduced space inside the chest literally restricts how much the lungs can expand. So ventilation is limited. And it can actually compress the heart itself.
Wow, so it directly messes with vital functions. Where does this usually come from? Is it something they're typically born with?
Primarily, yes. The source material leans heavily on it being congenital, meaning present at birth. Although, interestingly, it does mention one reported case that was acquired, which seems pretty rare based on this.
Just one, okay. And I saw something about a potential cause linked to early breathing issues.
Yes, that's a fascinating link suggested here. The idea is that if a very young animal has some kind of upper respiratory obstruction, it could create abnormal pressure gradients when they breathe.
Pressure differences.
Right. And over time, as they grow, this might actually contribute to the sternum getting pulled inwards.
Huh. That's an interesting sort of mechanical idea. Is this condition common? Do vets see it a lot?
Actually, the source explicitly says it's an uncommon defect.
Mm-hmm.
So while it can be significant for the animals that have it, it's not something you'd see every day.
Okay. And one thing that really jumped out at me from this material, it mentions other problems often showing up alongside it. Something about concurrent cardiac defects being common.
Yeah, this is a key takeaway, definitely. According to the source, animals diagnosed with Pectus excavatum often have other congenital heart problems too, at the same time.
So it broadens the picture immediately. It's not just the chest wall you need to think about.
Precisely. And then there's this term, swimmer syndrome. How does your source connect that to Pectus?
Right, I saw that.
Well, the source points out that some animals with Pectus also show signs of swimmer syndrome. This usually describes newborn puppies or kittens, who haven't quite developed proper posture yet. They tend to lie flat on their chests, splayed out. And the material suggests that this prolonged position, this sternal recumbency, could potentially lead to that inward pushing or invagination of the sternum.
So it might not always be purely genetic or something that happened in the womb. Early development and posture could play a role, at least in some cases, linked to this swimmer thing. That's a really specific idea presented.
It is. It adds another layer.
Okay, let's talk specifics. Who gets it? Are there particular types of dogs or cats more likely to have this?
It's seen in both dogs and cats.
Yeah.
Based on your sources, there does seem to be a predisposition in certain groups. For dogs, it mentions brachycephalic breeds.
Those are the flat-faced ones, like pugs, bulldogs.
Exactly. And in cats, it specifically calls out Bengal cats.
Bengals. Interesting. And what age does it usually show up?
It typically becomes apparent quite young. The most common age range mentioned for signs appearing is between 4 weeks and 3 months old.
Very young then.
Yeah. And looking at gender, the source specifically knows it's reported more often in male cats than female cats.
But not in dogs.
No gender predisposition is mentioned for dogs in this material. No.
Okay, so we're looking at young animals, potentially brachy dogs, Bengal cats, and especially male cats. Now, moving on from who gets it to what you actually, see or feel, what are the clinical signs?
Well, the most obvious starting point is often the chest defect itself. You might be able to see it, but it's typically easy to palpate as an indentation or just an abnormal shape in the chest wall.
But it's not always just about that physical dent, is it? The signs can be more widespread.
Oh, absolutely not. The clinical signs listed vary a lot in severity. Your source mentions things like difficulty breathing or respiratory distress to varying degrees,
Okay.
getting tired easily with exercise, weight loss, sometimes recurrent respiratory infections. Coughing is mentioned, even vomiting, sometimes that bluish tinge to the gums or skin cyanosis, just poor appetite.
And given the potential for heart compression or those concurrent heart defects, are there specific heart-related signs mentioned?
Yes. The source notes that heart murmurs can be present. Now, these could be from the chest compressing the heart, or importantly, they could be related to those concurrent congenital heart defects we talked about.
Right.
Muffled heart sounds are also listed as a possible finding.
Okay, so quite a list: breathing problems, heart signs potentially. But here's where, for me, this source material gets really interesting, maybe even a bit counterintuitive. It makes a very specific point about the link, or lack thereof, between how bad the chest looks and how sick the animal acts.
This is probably one of the most crucial practical points in your sources. It explicitly states, no correlation between severity of signs and severity of anatomic or physiologic abnormalities.
Say that again. No correlation.
No correlation.
Yeah.
Think about it. An animal could have a really severe, obvious chest deformity on an X-ray or just by feel, but show minimal or even no outward clinical signs.
Wow.
While another animal, maybe with a less dramatic-looking indentation, could be in significant respiratory distress or have major heart issues because of it.
That is a vital point. You can't just judge by looking at the chest shape. Are there other physical signs mentioned, besides the chest and maybe the limbs in those swimmer cases?
Yes, vertebral deformities, problems with the spine are also listed as something that can occur alongside pectus.
Okay.
And yeah, circling back to that swimmer syndrome connection, the signs there are those limbs not being positioned correctly under the body.
Yeah.
They stay kind of abducted, sticking outwards, which makes it hard for them to walk properly.
So it's a complex picture. Visible defect, varied functional issues, potential heart stuff, maybe spine issues, related developmental things like swimmer syndrome. Let's shift gears a bit. Why does this happen? What do your sources suggest about the causes and risk factors?
Well, the first thing to say is the exact cause is often labeled as unknown, or having an unknown etiology.
Okay.
While the source does say a genetic predisposition may exist, it's not really pinned down as the definite or sole cause in all cases.
So if the exact cause is often unknown, what are the suspected reasons? What factors are listed as potentially contributing?
The source brings up a few possibilities. Things like abnormal pressures while the fetus is developing inside the uterus,
Okay.
maybe a shortening of the central tendon of the diaphragm, that big breathing muscle,
Right.
a deficiency in the muscles of the upper abdomen, and also problems with how the bone or cartilage itself develops, normally what they call abnormal osteogenesis or chondrogenesis.
So several potential biological mechanisms. Are there specific risk factors identified that make an animal more likely to get this?
Yes, the sources point to a couple. Dogs that are already prone to upper airway obstructive issues, like those brachycephalic breeds, again, are noted as having a higher risk.
That makes sense, linking back to the breathing pressure idea.
It does seem connected, yeah. And linking back to swimmer syndrome, puppies raised on slippery surfaces, ones that don't provide good footing, might be more predisposed to developing swimmer syndrome itself, which then could potentially contribute to the sternal issue.
Interesting connection between environment and this physical outcome. You mentioned that single acquired case earlier. Does the source give any more detail on that one?
Just briefly, it notes it was in an older dog, a geriatric golden retriever, that had laryngeal paralysis.
Which is another breathing obstruction issue.
Exactly. So it kind of aligns with that idea that abnormal respiratory pressures could potentially play a role, maybe even later in life. Though, again, the source presents this acquired form as highly unusual.
Fascinating. So, given all these varied signs, potential other issues, how do vets actually diagnose this? How do they figure out it's Pectus Excavatum and not something else?
Right. The diagnostic process, according to this, starts with thinking about what else it could be. The source gives a list of differential diagnoses, other conditions to rule out.
What kinds of things are on that list?
Well, other congenital problems like a diaphragmatic hernia where there's a hole in the diaphragm,
Yep.
or tracheal malformations, a collapsed trachea. Also, various things that cause similar respiratory or cardiac signs. Congenital heart defects again, pulmonary edema, fluid in lungs, blood, or pus in the chest cavity, so hemothorax or pyothorax, pneumonia, bronchitis, and importantly, brachycephalic airway syndrome, tying back to that breed risk.
That's quite a list to sort through. So how do they confirm Pectus specifically based on this material?
Imaging. Imaging is absolutely key here. Thoracic radiography chest x-rays are highlighted as the main diagnostic tool.
What do the x-rays show?
They confirm the specific bone abnormalities of the sternum and ribs. They show the resulting decrease in chest volume. And they also reveal if the heart has been pushed out of place. The source notes it's typically shifted left and cranially, so forward.
And can the x-rays tell you more than just about the bones?
Yes, they can also show if there's secondary lung disease present, maybe due to the compression or chronic irritation. And the force also mentions these specific measurements you can take from the x-rays. Yeah, they're called the frontosagittal index and the vertebral index. These are used to actually quantify how severe the deformity is: mild, moderate, or severe. And apparently, these indices might also help predict how well the animal could respond to treatment.
That's useful. What about checking the heart directly, given those common concurrent defects?
That's where echocardiography comes in an ultrasound of the heart. This is specifically used, according to the source, to rule out those congenital heart defects or any other kind of heart disease that might be causing or contributing to the animal's signs.
Okay, so diagnosis involves the exam, ruling out other things, and then really relying on imaging x-rays and potentially echo to confirm it and assess the severity. Now, if an animal is diagnosed, what treatments are outlined in your sources?
A really key point the source makes right up front is that the decision to actually repair it, to intervene, is driven by the clinical signs, how the animal is doing. Meaning, if the deformity is just found by chance, say, on an x-ray for something else, and the animal has minimal signs, or maybe no signs at all, intervention might not actually be needed.
So not every case automatically needs treatment just because the shape is abnormal.
Correct, based on this material.
Hmm.
Now, if treatment is deemed necessary because of the signs, the options listed are external coaptation.
Like splints or braces on the outside.
Exactly, using external things to try and reshape the chest, especially in young, growing animals. The other main option is partial sternectomy, surgically removing part of the deformed breastbone. Or sometimes they might use a combination of both techniques.
Okay. And how do they decide which approach to take?
The source says the decision depends on the age of the animal and how severe the deformity is.
Who benefits most from surgery, according to this?
It states that surgery specifically benefits patients who are having respiratory distress because of the pectus. However, and this is significant, the source also notes that the benefits are listed as unknown for patients who don't have respiratory distress, even if they have a moderate or severe physical deformity on imaging.
That links right back to that lack of correlation point again, doesn't it?
It really does.
And what about those cases that aren't treated surgically, the non-clinical or maybe mildly affected ones? Does the source say anything about their outlook?
Yes, and this is another really important takeaway for managing these animals long term. Your sources explicitly state that patients who are non-clinical can develop clinical signs later on.
So it can get worse over time.
It can.
Yeah.
And furthermore, patients who already have some signs might show progression. Those signs could worsen over time, too. So even if an animal seems only mildly affected initially, you can't assume it will stay that way.
That's crucial. That idea you mentioned, that it might be playing a longer game. What about managing the other conditions sometimes seen with it, like swimmer syndrome or the brachycephalic breathing issues?
For swimmer puppies, the sources recommend making sure they're on surfaces with really good footing. It also mentions that gently helping position their limbs, maybe toggling them, might improve their ability to adduct, to tuck them under properly.
Okay.
And for the brachycephalic breeds that have upper airway obstruction alongside the pectus, surgery to correct those specific breathing problems might be beneficial.
Got it. If surgery for the pectus itself is done, any special considerations mentioned?
The source highlights that anesthesia needs careful, constant monitoring for these patients, and having ventilatory support readily available is important.
Makes sense given the chest issues. Are medications part of the treatment plan?
Medications are mentioned, yes, but primarily for treating any underlying or secondary medical conditions, not really as a direct treatment for the Pectus structure itself.
Okay, that covers diagnosis and treatment based on your sources. What about follow-up care and the overall prognosis?
Follow-up exams, the source says, are basically dictated by the clinical signs the animal is showing, or determined by the plan if surgery wasn't pursued.
Can this condition be prevented according to this material?
The source states there aren't any specific actions listed for avoiding the disease. It just reiterates that genetic factors may sometimes be involved, but doesn't offer concrete prevention strategies based on this info. And regarding the long-term outlook, it reinforces that idea that progression of respiratory signs is possible, even in animals that started out non-clinical or only mildly affected.
So keeping an eye on them sounds really important. What's the general prognosis given?
It's described as guarded to good. The outcome seems to really depend on whether intervention if it's needed, is timed correctly and done by someone with expertise.
Right. Well, this has certainly been a deep dive into Pectus excavatum, based entirely on the source material you provided. We've gone from the definition that's structural chest deformity
Oh.
through who gets it, those links to brachy-breeds and Bengals, the really wide range of signs, and that surprising lack of correlation between how bad it looks and how bad it is functionally.
Yeah, that's key.
The suspected causes, how it's diagnosed with imaging, the treatment options, and prognosis.
It really highlights the nuance needed, doesn't it? It's
Yeah.
clearly more than just a dent in the chest. It involves potential underlying causes, related problems, and that important factor of potential progression over time.
Absolutely. So, reflecting on all this information from your sources, what's the big takeaway for you? Perhaps it's this idea that structural conditions like Pectus excavatum, even if they seem mild at first glance, aren't necessarily static.
Mhm.
That possibility of signs developing or worsening later, even in cases that initially look okay, really underscores the need for careful, ongoing assessment. You can't just dismiss a physical abnormality because it isn't causing obvious severe problems right at this moment.
That's a really valuable point. A good reminder that conditions can evolve, and the initial snapshot doesn't always tell the full story down the road.
Exactly. Something important to keep in mind as you think further about this information from your deep dive. Thanks for joining us.